Today I'm going to share with you the bonding process for oxide paste veneers. Actually, bonding oxide paste veneers is not much different from bonding glass ceramics. Currently, oxide paste ingots at the factory are sprayed with anodized bioamic, and after sintering they become glass ceramics. So the bonding process is actually the same as with glass ceramics. The only difference is that the hydrofluoric acid etching time needs to be extended to 60 to 90 seconds. If you use UHO plus hydrofluoric acid, etch for 90 seconds, and use high concentration hydrofluoric acid for 60 seconds. This is the treatment for the abutment. Then, after trying in the veneer and confirming there are no issues, first use an oral isolation film to protect the two adjacent teeth. We need to use B4+. This is actually my main technique for bonding ceramic veneers at present. Use the index finger of your left hand to gently pull the dirty cloth downward and aside, then, after roughening with aluminum oxide sandblasting, etch the tooth surface with phosphoric acid for 30 seconds. Do not rinse or dry. Start applying the adhesive directly. The adhesive I'm using this time is Kerr's brand new 2-bottle 8th generation adhesive. Normally, 8th generation adhesives come in a single bottle, but their new version comes in 2 bottles. The first bottle is the primer Prima, and the second is the adhesive. Now, apply the second bottle, then blow it to make it as thin as possible. For this tooth, there isn't much denting exposed, and it's not very sensitive, so I didn't use any anesthesia. Also, since this patient is my younger sister, she specifically requested ultra-white veneers. I've previously shared on Weibo about removing porcelain veneers with a sapphire water laser and redoing them, as well as the tooth preparation for this case. You can scroll up to check it out. For the bonding, I used the whitest resin cement Ivocars V1 Light. After light curing, use a number 12 blade to scrape off the excess resin cement, and then use dental floss to go through the contact points with the adjacent teeth. Now, we use 2 curing lights together for 30 seconds, curing both the labial and lingual sides at the same time for 30 seconds. If you're only using 1 curing light, you need to cure for at least 1 minute. Be careful when scraping with a blade that can injure the gums and cause bleeding. With this technique for bonding porcelain veneers, since you didn't use floss ties, B4 clamps, or any other clamps, the immediate post-operative condition of the gums is excellent. There won't be any obvious redness or bleeding. Let's take another look at the entire procedure. This is for bonding another number 1 tooth. First, sandblast to roughen and clean the surface. Then place the porcelain veneer on for a trial fit to ensure it seats completely. This step is crucial before bonding any veneer. You must always try it in the mouth to confirm everything is correct before proceeding with the bonding. Then, on the side with the porcelain veneer, just place a piece of dental floss. For the prepared abutment teeth without porcelain veneers, use Teflon tape for isolation, then apply phosphoric acid etchant for 15 to 30 seconds. When the time is up, have the nurse help you suction off the excess phosphoric acid, then rinse thoroughly with plenty of water and dry it. Be sure not to leave any phosphoric acid residue on the lingual side, so make sure to rinse the lingual side as well. Next, apply the first layer of Kerr's 8th generation adhesive, and blow it until it's as thin as possible. Since it's all enamel, I apply it relatively quickly. Then start applying the second layer, and blow it until it's as thin as possible. If there's a lot of denting exposed, I recommend applying the first layer twice, each time for more than 20 seconds. Then place the light brand cement, reposition it, and use this scaler to remove the excess cement. After cleaning thoroughly, remember to reposition the veneer and cure it with a light again. Then remove the dental floss, run it through a couple of times to make sure the teeth are separated, and then use a blade to remove the excess cement along the tooth surface, not digging into the margin line. Doing so could cause micro leakage at the margin. Instead, scrape along the tooth surface. Pay attention to this technique. Then apply glycerin gel to block oxygen inhibition, and cure thoroughly for 30 seconds. Actually, it's 1 minute, because I cured both sides together for 30 seconds. Then run the dental floss through again, and we can continue bonding the next ones.